Our Community Health Services branch is home to several programs that help improve communities' health. The programs include immunizations, children with medical handicaps, communicable disease, prevent blindness, injury prevention, harm reduction, Ohio Buckles Buckeyes, tobacco cessation, and women, infants, and children, or WIC. We provide information, guidance, and cleaning resources to families with elevated lead levels. Throughout several of our programs, we promote safe sleep practices for newborns and infants to reduce the number of deaths from sudden infant death syndrome. Infants should be placed alone, on their backs, and in an empty crib to sleep safely. Books and other educational materials are distributed to the community to promote safe sleep. The immunization program is probably the most well-known of the services we offer. With the help of the two federal programs, Vaccine for Children and Section 317 of the Public Health Service Act, CCPH can provide no-cost vaccinations to people who don't have health insurance. The Vaccine for Children program serves children up to 19 years of age who are uninsured, underinsured, or unable to pay. The 317 program is a similar program for adults without health insurance. CCPH conducts vaccination clinics at the Community Health Services building and through community outreach events. Because of the summer weather, we cannot vaccinate at our fair booth or outdoors when the temperature is above 77 degrees Fahrenheit. During the pandemic, we expanded our homebound vaccination program and offered routine vaccines in people's homes if they cannot get to their healthcare provider. In addition to routine immunizations, CCPH also provides consultation to people traveling internationally. With these consultations include health and safety practices and immunizations that are recommended or required for travel based on the destination. Common international travel vaccines are yellow fever and typhoid. Prevent Blindness Ohio is a statewide program that helps people get free eye exams or glasses. Clermont County residents who don't have vision insurance can call our office to see if they qualify for services. To qualify for the program, a person's household income must be 200% of federal poverty guidelines or lower. If approved, they will receive a voucher to take to a local provider who donates their time and expertise to help with getting an eye exam and glasses. Angela Lips and Tara Jemison are certified tobacco treatment specialists who manage our tobacco cessation program. Tobacco treatment specialists can offer tobacco cessation counseling to help residents quit using tobacco. They cannot provide nicotine replacement therapy directly to individuals. Angela and Tara routinely provide this counseling at the Clermont County Jail to people who are part of the Clermont County Alternative Sentencing Program. The Children with Medical Handicaps program helps people with special healthcare needs. The program coordinates resources and provides home visits and coverage for diagnostic services and treatment. The program is open to anyone up to 23 years old with special healthcare needs and meets the medical and financial eligibility criteria. Even those with insurance may qualify for the program. Ohio Buckles Buckeyes is a program that provides child safety seats and booster seats to eligible low-income families throughout Ohio. The Communicable Disease Program is one of the few programs under Ohio law that local health departments must manage. The health department must respond 24 hours a day, 7 days a week, 365 days a year for certain infectious diseases. A reportable disease is one that the healthcare providers are legally required to notify the local health department about after a diagnosis. The reportable conditions are divided into 3 categories. Class A diseases require immediate reporting and immediate action from the health department to limit the spread of the disease and its impact on the individual that was diagnosed. A Class A condition includes anthrax, measles, MERS, and smallpox, among many others. Class B diseases must be reported by the next business day and need public health action within the same time frame. Some Class B conditions are hepatitis A, Lyme disease, meningitis, mumps, and pertussis. Class C reportable conditions include an increase in certain diseases in a community or disease outbreaks. A Class C would be a foodborne illness outbreak associated with a restaurant or waterborne illness. An outbreak could be a report of an isolated case, just one individual diagnosed. We enter all reportable diseases into the Ohio Disease Reporting System. Public health nurses or epidemiologists conduct disease investigations, which can include calling the sick person to see where they have been exposed to a certain illness or to make sure that they are following guidelines to limit the spread of the disease. The pandemic highlighted the health department's role and importance of mitigation strategies to promote community equity, health, and wellness. Isolation and quarantine are not new evidence-based strategies for mitigation. They have been impactful in minimizing disease transmission over many years. Diseases that require isolation include, but are not limited to, measles, yellow fever, infectious tuberculosis, viral hemorrhagic fever, an example is Ebola, and smallpox. Other mitigation strategies for disease prevention include washing your hands, respiratory hygiene, covering your cough and sneezes, staying home when ill, and staying up to date on immunizations for vaccine-preventable diseases. The Harm Reduction Program is also known as a Bloodborne Pathogen Prevention Program. It is an evidence-based program providing services to minimize the spread of HIV and hepatitis C. Harm reduction services include exchanging used syringes for sterile ones, HIV and hepatitis C testing, Narcan to reverse an overdose, and fentanyl test strips. If someone tests positive for HIV or hepatitis C, the program refers them to treatment. The Injury Prevention and Drug Overdose Prevention Program aims to create a healthier community by reducing unintentional overdose fatalities in Clermont County due to legal and illegal drug use. The program makes life-saving naloxone more accessible to the community. It also educates the community about substance misuse. The program provides education and awareness about storing medications safely and disposing of unused medicine to reduce accidental drug overdoses. Proper disposal includes drug disposal bags, drop boxes, and biohazard containers. You should always follow the medication manufacturer's or FDA's instructions for a safe disposal. The Overdose Fatality Review monitors and analyzes drug overdose trends to influence equitable strategies and activities to prevent future fatalities.